Hi, everyone. I am so excited that this is the launch of our Light a Red Candle campaign for P.A.D. awareness and the effectiveness of walking as medicine to stall progression and even prevent a disease more prevalent and deadlier than most cancers combined, known as peripheral artery disease, or PAD, which is blocked arteries in mainly the legs. And this light a red candle campaign was the brainchild of our friend Marcia Burr, who offers our Moving Mondays. We really appreciate Marcia coming up with this idea for Light a Red Candle for PAD awareness, and that walking is the best medicine for preventing and stalling progression of peripheral artery disease. I'm going to kick things off with Anita Dubois sharing her ideas on how to walk effectively.
Peripheral artery disease in the intermittent claudication sense, when you have a situation where you do not have wounds and you do not have what's called rest pain, where you're just sitting there in your chair, but your leg hurts a lot. So you're not in that category. We're just talking about purely here, it hurts when you walk, whether it's 5 steps or 100 steps, it hurts when you walk. That's the intermittent claudicant. That patient can really, really turn their life around by walking. Now, how do you do that? This is how you do it. You wake up in the morning every day. You commit yourself to 30 minutes of continuous walking. But here's the ticket. It cannot be, I go for a walk with my spouse, down a couple city blocks, stopping to pet someone's dog, stopping to check if they're fresh avocados. No. Every time you stop, the clock restarts. So what you would need to be in is either in the mall or on a track where you can continuously walk, because you need to turn that watch on. So you got your iPhone or whatever you have to time yourself. You turn on the timer and you start walking. And I don't care if you walk 7 steps or you walk 7 miles. You document. I walked this far today in time, right? Before the pain set in. And then you document, I walked this much further with the pain, because that's what I need to know. I don't care how far you walked. I want to know, how far did you walk when it hurt? Because that is what's building those blood vessels. You can walk for 7 miles, okay? But on that 7.1 mile, when you start to feel the pain, that's when you need to give yourself another 5 to 10 minutes of walking, to the point where you're actually limping, because that's where your body is saying, you've got a tribunal basically that sits in your body that has a certain amount of resources. And it has to decide, what am I going to do with these resources? Where am I going to lay down new blood vessels, right? And if you hurt your body essentially by walking, the legs are telling the body, I need you to invest in me and create new blood vessels in me, so that I no longer have pain when I walk. It's no different if you were working out in the gym and you're doing a bunch of reps with your biceps and you get that pain in your biceps when you're working out. What do they tell you to do? What does your instructor tell you to do? Oh, give me one more. Why? Because it's in those moments when you have that severe pain where you're actually going to be building blood vessels. You can do 100 reps like this, no big deal, but it's that last 2 that build it. Exactly the same physiology in the legs. It's no different than if you live in a city and you have a city council and there's a crappy road outside your house. The person who goes and complains 1,000 times, screaming and yelling and picketing and chaining themselves to the city council, is going to get money to get that road built. The person who doesn't is the one who's going to get nothing. And in fact, they might let the road deteriorate more. And that is what happens when you don't walk, when you have intermittent claudication. Most people will stop walking when they're in pain naturally, right? And so, and a lot of doctors will tell you even to do that, because they don't know. They don't want you to get injured. Your PCP may not know. If you get one of those little chairs that you can flip out and sit down, that's ideal, because then you don't have to go somewhere to sit down. You sit down, and the minute that you can go again, you go again. And you do that for 30 minutes and you document each time. How far did you walk? How far with pain? How far did you walk? I guarantee you, I will give you this in blood writing, okay? That if you do that in 6 months, you will increase your walking distance and decrease the amount of time that it takes, basically, that you have to sit down, essentially. So you'll be able to walk further with less pain. And that's what this whole creating new blood vessels is, because what's happening? The city council in your body is building that road for you. and you have a little piece of blood vessel down in your ankle, a little piece of blood vessel up top, it makes the connection for you. So it doesn't open up what's already gone. It doesn't do that. But it does create these new connections for you. Are you going to be able to run the Olympics? Unlikely. But are you going to be able to enjoy your lives? Go out to the mall, go to a movie, walk around, do what you want with your grandkids? Yes, you will. And all with avoiding a bypass or avoiding a stent. Walking is the only thing that has level 1A evidence, as in randomized controlled trial, highest level of evidence in the world, to say that if you walk, you will be able to increase the blood vessel collateralization, which is what that's called, creating those new networks, and you will be able to walk further with less pain.
That was Anahita Duwa, vascular surgeon with Mass General Hospital.
Amazing. That is my favorite explanation, Dr. John, on how to walk effectively to grow collateral vessels. And it's so interesting. And I love your candidness about the fact that in medical school, they don't teach you how to teach your patients how to walk effectively. So the majority of doctors out there are telling their patients to just go walk. And patients come to us at the Global P.A.D. Association and say, I've been walking all my life. I go walking a mile or two a day. I don't understand why I'm getting peripheral artery disease. Or they'll say, I walk all day on my job. I don't understand why my doctor is telling me to walk, walk, walk when I get in 20,000 to 25,000 steps per day. What Dr. Duwa is saying is it is not about the steps. Everyone wants to give everybody a step tracker, right? We even had some amazing ones donated by the Society for Vascular Surgery Foundation, which we're really excited about. And I'll have more on that in a moment. But because everyone wants to count their steps, but also what I like about the step tracker that they got us is that it also has a stopwatch. And what Dr. Duwa is saying is that it's more about the stopwatch than it is about the steps. It's more about the time that you spend actually walking with that claudication that is going, and you're pushing through that pain to the point where you're almost at a limp, and you're like, you know what, I think I need to slow down. And instead you stop and you rest and you start that stopwatch again. And she says you do this for 6 months and you're guaranteed to literally improve your symptoms. So I'm curious, your response, in seeing this video.
Well, number one, it touches on a couple of, salient points. First off, and this, I get this a lot from patients from a cardiovascular standpoint. A couple of things I would ask them, hey, are you exercising? No, I walk 10,000, steps at work. That doesn't count. The start and stop, as she mentioned, doesn't count. What you need to do is walk at a pace where you could potentially talk to somebody next to you, but you're kind of short of breath. And so you don't necessarily want to talk to them. That for me is enough exertional expenditure of energy to be exercising, to getting the heart rate up, and to working the muscles to build the collateral vessels. And the other thing that she had mentioned, and I have several patients, we've had one of whom was a Save My Piggies guest, Bill. He kept track. Okay, one day he on the treadmill, he got to 0.25 miles. Next day it was 0.28 miles, whatever it was. The more you walk, you get the discomfort, you push on a little bit further, you rest and go back at it. It is simple, but yet difficult because number one, you're turning your brain off a little bit to not to go past the pain, which can be, difficult for people. But also it takes energy and effort and discipline. And a lot of us, myself included, sometimes lack that discipline. And so, and I've said this on the show, the pain of regret stings more than the pain of discipline.
That's true. It's tough to actually make that determination though in that moment, right? When you're feeling that pain, you feel like you just want to do anything to turn it off. But it's different, that pain you experience. So we're trained from when we were young and we were in our physical education classes, our PE classes. When you get a muscle cramp, you need to stop, you need to rest, you need to hydrate. But you're going to injure yourself if you push through. But as Dr. Duwa is saying, that muscle cramp is different. It's a different type of muscle cramp when you're simply lacking blood flow and you need to literally allow your body to trigger that pain, triggers the collateral vessels, that collateral network of vessels to wake up, to dilate. And I always say grow, because like a tree root, they actually find their way around a blockage, and they call it reconstitution. It's where the collaterals reattach back in the vessel below where the blockage is. But I was corrected by a vascular surgeon who says, you can't say they grow. And I said, well, how do you define angiogenesis then?
Well,
I mean, that's
so
really, isn't that the mechanism of action
well,
by which they do?
you have, so we kind of think of the arteries as like one singular tube, but there are these little micro branches, I think, that exist and permeate within the muscle beds that are kind of sleeping, and they only get really activated, meaning we see them on an angiogram if someone has a blockage, because the pressure gradients start to change. But I did an angiogram and a procedure on a gentleman yesterday who had an occlusion of the artery in the femoral artery in the thigh, and he had a massive collateral from it. Now, the collaterals grow in the sense that the longer they're there, the more kind of robust flow they get. But what we're talking about here is individuals who have that claudication, who have discomfort when they walk. Typically, it's in the calf. That is a discomfort that you kind of have to train your mind to say, okay, let's see, I get my symptoms at maybe 100 yards. So psychologically, you're thinking, okay, I'm going to have to stop at 100 yards. You just have to move the goalpost a little bit and move it back. Say, okay, let's go to 110. And then let's go to 120 or whatever it is. As long as you, and this is what I tell my patients, as long as you are able on a daily basis to increase your walking, I don't care if it's one step or two step, like Anita said, just do it. You will continue to be able to push the boulder up the hill, climb the mountain, whatever metaphor you want to use. And then you're going to feel, I mean, I imagine, and I wish I could recreate the pain that folks get with claudication, because I'd love to be able to empathize better, because it's easy for me as a doc who pushed through it, but I don't know what that pain is like. And I've had patients, a lot of them tell me that the straight kind of level field or street's fine. It's that incline that gets them. And so what I've been telling my patients to do as well is, if they have a treadmill, maybe take the incline up to 1 or 2 and do the walking, because that requires more energy expenditure as well. And I think that'll probably help them in general. But at the end of the day, what you're doing right here, light a red candle, is just, I mean, I don't know if it's a metaphor for lighting a candle under there, what, and get going. But we want to do it. We want to do it for at least 3 months, because we talk about 12 weeks of treatment for a walking program. And as Dr. Dawad mentioned as well, you have level 1 evidence that walking works. You just have to do it. And so the start and stop doesn't count. Walk until you're a little bit, you're kind of short of breath. You could talk to somebody next to you, but it's uncomfortable. That's the pace you need to go at. And every day, go a little bit further. And I guarantee you will be successful in this endeavor.
Right. It seems to be, no matter really where you are at in your level of disease. We've had even CLI patients, and you were talking about Bill, who you brought into our Save My Piggies series, who was in CLI, the critical limb ischemia, the most advanced stage. Well, the most advanced stage now, the new guidelines come out, said that it's acute limb ischemia. But critical limb ischemia is right there. I kind of liken the two, but it's where doctors have fewer options. Bill was able to walk his way out of having an amputation. Amputation was the next step, and he was able to grow enough collateral vessels, right, to be able to maintain a certain lifestyle. As Dr. Duaz said, you're not going to be running marathons unless you're Kevin Morgan, our patient we interviewed just recently, who is 80 plus years old, and he was able to figure out a way to persevere with not only P.A.D., but also with an aortic aneurysm that was stented. And he was able to compete and finish in the World Ironman Championships in, I think it was Switzerland or Sweden last year, and he's just qualified again. And so you may not reach that level. You don't have to reach that level. Everyone's different. Do not compare yourself to anyone else. If you're at the point where the pain prevents you from getting out of the bed, well, you know what? Start moving your legs in bed. Start doing the exercises in bed. Take the sheets, the bed sheets, start pushing them up and down, right? Start just moving, moving, moving. Then get to the point, get your feet on the floor, take a few steps, take another few steps. Each person is going to be different. And the goal is going to be to then just keep progressing, keep progressing, keep progressing. Now, the other aspect of it, Dr. John, is how do you, get your mental state to be able to cope with all of this pain and those days in which you might feel as though you've backtracked, because it's so different. Patients report that they will actually walk, 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 and then suddenly they feel like they can't walk, walk, walk as much, and they don't feel like they've changed anything. They don't feel like their diet's changed. They don't feel like their hydration's changed, because the first thing that a doctor will say to them is, well, did you hydrate properly? Second thing is, well, if you have diabetes, blood sugar and the amount of sugar and carbs you take can actually impact your ability to walk further and faster. But a lot of it is just there are ebbs and flows, right?
Oh, 100%. And I think with anything, and I mentioned this before, you have to begin with the end in mind, meaning what is my goal? So again, it's a 12-week 12-week program. So, okay, at the end of 12 weeks, I want to be able to walk however far. So then set that as a goal and take it on and go.
Right. And so for the Lighter Red Candle campaign, because of that, because it is standard that level 1A evidence, that 12 weeks, you got to do 12 weeks. And that's why we're kicking off on June 1st. We're finishing off on September 1st, which marks the start of P.A.D. Awareness Month in September. And every P.A.D. Awareness Month, the Society for Vascular Surgery Foundation challenges doctors who treat peripheral artery disease to walk, walk, walk over the course of the month and get as many steps and miles in as they can and raise money for P.A.D. awareness. And they kindly enough donated all of the funds, or a good portion of the funds, to the Global P.A.D. Association to buy step counters, really nice step counters for patients. And they donated more than 2,000 of those to us to give out to patients in need. Now, what I like about these step counters, I'm not a big fan of just a pedometer, and I explained that earlier. And Dr. Dubois explained it, and Dr. John reiterated it. It's not about the number of steps you take. It's about the time you spend pushing through that claudication. And that's when it triggers the body's collateral network of vessels to kick in and start building those natural bypasses. That's what's really key. And I see you, Dr. John, nodding your head.
Yeah, 100%. And my final thoughts are, because I know you want to get to testimonials and get folks fired up and light the
Right.
candle, but my final thoughts are just do something.
Yep.
Okay. There's a lot of inertia out there, and the 6 inches between your ears is the most powerful organ that you own. And frankly, you don't even own it, but just do something and you will thank yourself. Your body will thank yourself. Your legs will thank you, and your heart will thank you. And with
Yep.
that, awesome job, Kim. You got to send me one of these candles, or I got to get one of these at some point. And on the air here, whatever, I will beat anybody's steps in that 12-week period. What is it, June to September? I will beat anybody's steps.
Oh, I think that's a challenge. I'm so happy. Actually, we're going to hold you to that for P.A.D. Awareness Month. So everyone's got to get those steps in. Go to lightaredcandle.org. It's not too late. Just because we're all starting today to light our red candle, you start when you hear about this, when you're inspired to start. Get your red candle from us. It's you can get them at lightaredcandle.org. You can also light any red candle. I don't care, light any candle. It's the symbolism. It's symbolic that you're just, again, Dr. John, it's lighting that fire under you to get that improved circulation. And what our candles say, and our motto for this is light a red candle, illuminate the path to health, light the candle, walk the way to improved circulation. And that red actually represents the improved circulation that we all desire and we hope to have at the end of these 12 weeks. And for those who don't have peripheral artery disease, it's a chance for you, because still heart disease, heart attacks are the #1 killer, right? 3 in 5 people who suffer a heart attack have peripheral artery disease, those blocked arteries in the legs. And did you know you can not only build those collateral vessels in your legs, you can also build them in your heart. I've heard over and over and over again from patients coming to us and saying, hey, you know what? My doctor said I had a CTO, a chronic total occlusion, a 100% blockage in my heart, but I was saved by these collateral vessels. Collateral vessels actually grow around blockages in your heart as well. So it's really important to walk. Walking's the best medicine. Let's walk ourselves. Let's challenge others to walk, as well. All summer long, the best time that you can walk. If you can't walk on inside, find a mall to walk in, find a store to walk in. I know so many patients that walk even in just Walmart. Walmart can be, those super centers are pretty big. Walk at a brisk pace. If you need a shopping cart to help stabilize you, use a shopping cart and walk, walk, walk all summer long. So the key is that we're going to be walking all summer long, and then we're going to be challenging Dr. Phillips and other doctors through the Society for Vascular Surgery Foundation who participate in their monthly walk over the course of P.A.D. Awareness Month, which is September. And we're going to challenge them to beat the steps that P.A.D. warriors take all summer long. Now, if you haven't signed up on lightredcandle.org for us to count your steps, which over the next couple of days, I'm going to add you to our system, and you're going to get a text every single day at 7 p.m. your time to simply type in the amount of steps. Now, I know I said that the step count doesn't really matter in the overall scheme of things once you do have them, but it's the only way that we can literally just create some sort of accountability and some sort of measurement that we can put up against the other doctors to say, hey, beat this number of steps. Okay. So that's what we're doing. And with that being said, I would love everyone who is here in our live studio audience, or even if you're just, watching on YouTube or on our social media channels, to go ahead and grab your candle. If you don't have a candle, that's fine. We would still love for you to participate. Here's how you can participate in the live studio audience is we're going to have you light the candle with us. I'm going to put it on the grander view. So if you can actually come on camera and light your candle, if you don't have a candle, I don't care. Just go through the motions with us. And we're going to pretend even to light a red candle. And we have these special candles that we created thanks to Marsha Burr. She's the brainchild. She's our P.A.D. Oh, this smells, that smells really good. We have all kinds of different scents that are with our candles that you can buy. But as I said, if you didn't get it, go ahead and buy your red candle now and then light it at any time and share your goal. The key is share your goal. Light your red candle, take a picture, take a video of it, share your goal for walking this summer. Even if it isn't the 12 weeks that we're counting on between June 1st and September 1st, go ahead, light your red candle at any point that you see this and are inspired. The key is, what is your purpose for walking? Is it your kids? Is it your grandkids, to see them get older and to graduate, or to have kids and grandbabies and great grandbabies? Is it simply just to be able to do something you love, to even be able to grocery shop without having to stop and sit and rest going down the aisles? What is your purpose? What is your goal? Okay. What is your purpose? And then what is your goal for the summer? How many steps are you going to take? How many minutes are you going to walk? What is your goal? Okay. So with that being said, what do you say? We light our red candles. I want to see everyone lighting your red candle. I can see Judy has already lit her red candle. Let's see who else has lit their red candle. Don't burn the house down, please. I should give you a disclaimer, which is with all our videos. There's my red candle. It is lit right now. Make sure always check with, do not burn your house down. Do it safely. Make sure to blow it out as soon as we're done here. Don't leave a candle unattended at any point, ever, ever, ever. Always blow it out when you leave the room. Make sure it's out completely. But before you start walking this summer, it's also really good. Check with your doctor to make sure how much walking is right for you. Get that clearance from your doctor. Get the goal from your doctor. Know what's right for you. Even more importantly is for those chronic kidney disease patients. Make sure you check with your doctor on how much to hydrate, especially when you're increasing your walking. That's really important. And with all that being said, once again, here is our candle. We're lighting it. We're lighting a red candle for P.A.D. awareness, a disease more prevalent and deadlier than most cancers combined. But there's so much you can do to prevent it. And one of those, the best medicine is walking is medicine to prevent and stall progression. So we're all lighting a candle to light a fire under ourselves, to get out there and walk over the next 12 weeks. Walk this summer and inspire others to walk. My purpose for walking actually is for all of you. You inspire me every single day to get out and walk and to move. And with every step I take, I think of every single one of you and the strongest men and women and people I know who are persevering with a disease that is so debilitating. And you're so strong to be just pushing through. For people who don't have P.A.D. and don't understand this, just imagine the worst Charlie horse that you've ever experienced, where your foot just feels like it's going to break off and you have to push through that pain. That's what these people are experiencing. And so they're pushing through, and so can you. We're doing this together.